Welcome back. You've heard about devastating medication errors happening with people, but pet owners, listen to this. You're not, though, are you, Gino?
No.
I am. But the FDA just issued a new warning because investigators are finding prescription mistakes happening with pet meds, too.
We're going to let you know how you can keep your dog or cat safe.
All Sarah Shuck has left of her beloved 8-year-old Labrador Rafter is this collar, pictures and fond memories.
It was really hard.
Hard because it shouldn't have happened. Sarah says the drugstore that filled Rafter's prescription made an error. His prescription bottle label said to give Rafter 2 1/4 teaspoon. Problem was, Sarah says the dosage her vet called for in the pharmacy was for much less, 2 1/4 cc's. The overdose combined with Rafter's health problems was too much. She said she had to put him to sleep.
And it was a tough realization.
Just days after Rafter's death, the FDA issued a warning about a pattern of pet prescription mistakes. FDA investigators discovered errors stemming from simple issues like look-alike packaging, drugs with similar names, and simple penmanship errors.
The consequences can be completely devastating.
Dr. Silberman takes prescription precautions at his office. All medication and dosages are typed into a computer. Only vets or the vet techs fill prescriptions, and the pet's pictures are printed on the label, so there's no mix-up.
We do a tremendous amount to make sure that those things don't happen.
The FDA says while mistakes do happen at vet-based pharmacies, when pet prescriptions are filled in human pharmacies, like in Rafter's case, different systems may be to blame. Abbreviations are a common cause of errors because prescription shorthand taught in veterinary school is different than in medical school, and some pharmacists may not be as familiar with vet abbreviations.
Currently, most of the pharmacy curriculums don't touch upon vet medicine.
Pharmacy insiders say if pet owners shop around to find the lowest cost on pet meds, they need to do their research as well.
Their primary concern should always be whether or not that pharmacist is knowledgeable in the area of veterinary medications. Price should be a secondary consideration.
How can you avoid a pet prescription mix-up? The American Veterinary Medical Association says communication is key. Make sure the pharmacist speaks to your vet if there are any questions. The FDA advises you should verify with your vet the name and dosage of your pet's drug. Sarah says she hopes Rafter's legacy lives on to help other pet owners avoid medication mistakes.
Don't be afraid to ask questions. Oh.
Now, FDA investigators also found pet medication errors stemmed from pet owners misinterpreting labels and accidentally giving their pets an overdose.
For more tips on how to prevent pet medication errors and how to report mistakes to the FDA, go to our website, kmir6.com.